Hello, I'm Dr. Brad Holmberg, co-founder of InvisalignDoctors.com. This presentation will cover how to resolve a posterior open bite. This tutorial and many more can be viewed on our learning website, www.InvisalignDoctors.com. Have you ever seen this at the end of one of your Invisalign cases? I have, because this is one of my cases. Why did this occur and what caused it? This is a question I've asked myself. What caused a posterior open bite in my case, and did I overlook something? In my case, there was a bilateral posterior open bite. Could the reason be premature anterior contacts after we got done with the active stages? I would say definitely yes. Premature anterior contacts are the most common cause of a posterior open bite situation. Let's take a closer look at my case again. There are no posterior contacts distal to the first premolars. Now this occurred on both sides, so this is a bilateral posterior open bite. Before I discuss how to resolve a posterior open bite situation, you need to understand how to prevent it. Preventing a posterior open bite requires applying these special protocols to your ClinCheck setups. Doing this will help prevent premature anterior contacts at the end of treatment, which is the primary cause of a bilateral posterior open bite. In the next series of slides, I will go over how to resolve a posterior open bite. I published a tutorial on how to prevent a posterior open bite on our learning website, InvisalignDoctors.com. I recommend viewing this tutorial also. Here are the steps taken when only anterior teeth are contacting and you're trying to resolve a posterior open bite. I recommend removing the attachments because usually different attachments are needed to resolve a posterior open bite. Then take accurate impressions or a scan, and it's best to take photos so that the virtual mount can be checked when the ClinCheck arrives. The big challenge is for the technician to mount the case correctly. In other words, the articulation of the arches in ClinCheck has to agree exactly with the patient's bite. An iTero scan can accurately articulate the arches without any problem. Just make sure the patient is in CR or CO when the bite scan is taken. If you are sending PVS impressions, take a PVS bite also and request in writing that they use this bite to mount the case. Mark all occlusal contacts with articulating paper for the photos so the technician can compare them to the 3D model once it's mounted. When the ClinCheck comes back, verify that the virtual mount is accurate. It is crucial the virtual mount is accurate before proceeding to set up a ClinCheck. And mounting a posterior open bite case is more difficult. Step 2 is creating accurate instructions for the technician to resolve those premature anterior contacts. Instruct the technician to create 2 millimeters of open occlusal contact in the anterior region. Include all teeth that display premature contacts. By doing this, you'll be overcorrecting those premature contacts, and overcorrection is usually needed to resolve them. Also request an occlusal jump at the last regular stage, which is a simulation of the mandible auto-rotating into a more closed position after anterior bite is opened up. Allow the technician to apply multiple movements to these teeth. That could be intrusion, lingual root torque, labial crown tip, IPR. Any movements to increase that functional overjet should be allowed. Thank you for viewing this tutorial. Consider joining our community of Invisalign doctors on InvisalignDoctors.com. This tutorial and many more can be viewed in their entirety. Personalized case assistance is also available on our site.